And on today's podcast, I'm delighted to be chatting to Dr. Jeff. How are you today, Dr. Jeff?
Hello, thank you for having me.
My pleasure. Let's get this started. For some reason, the listeners like this the best is where are you right now on planet Earth?
I'm here in a suburb of Las Vegas, Nevada, USA, called Henderson. We're just very, very close to Las Vegas.
Wonderful. So you had to give more information about that. So if I was moving there, going on holiday or going on some sort of work study or study program, you sell it, sell Henderson, Las Vegas.
Uh, yeah, Henderson is a very nice, typical new American suburb. I say new because, it's been here probably the newer parts, maybe 20, 30 years. Compared to where you are, David, that's really new, right?
Yes. Oh yeah.
So Uh, but Las Vegas itself has a wonderful, rich history. We have the amazing Boulder Dam and Lake Mead, and it powers a very good part of Greater Las Vegas and other and points beyond. So there's all kinds of. We have mountains, we have desert. It's very hot. You may not want to come in the summer, in the later summer and very early autumn, but we have seasons the rest of the year. We have lots of nightlife, great restaurants. We have the casinos if you're into that, but we have shows and sports now. Las Vegas is a very big sports town. I don't know when this will air. I imagine you're a very quick editor, but
Yes. It goes out
uh,
immediately, out the door.
perfect. So today it's here. Here it's May 6th, and we our hockey team is in the playoffs for the Stanley Cup, which
Oh
is a big
wow.
deal. Yeah. So we've got professional football. We're looking soon to have baseball and probably basketball down the line.
Cool. And you mentioned hot. I mean, how hot are we talking about here? Are we like burning?
Well, we talk in English system, even though the English have abandoned it, and it'll get to 115 degrees on a bad day in late August, early
Oh,
September. Yeah,
115.
115. Yeah. So we typically have 30 to 45 days over 100, I would say, easily.
Right.
So it's the great city of air conditioning. We're inside for most of the time, and it's very dry. This is the desert, right? It gets very dry. The desert gets cold at night and hot during the day because there's no insulative, moisture.
So how do you manage then that, Dr. Jeff? I mean, how do you manage that 115 degrees? I mean, is it just do you become acclimatized to it, or do you have to put factor
Oh
50
no.
on every day, or what goes on?
You go from the home to the car to your office, and everything is air conditioned. You go right back, right, and reverse that on the way home. And maybe some nights we take a dip in the pool because almost every home here has a pool, I would say.
Right. And is like the rates of, I know we're off topic here at the moment, but as you've mentioned, 115 degrees and the sunshine, are the rates of cancer, skin cancer quite high?
That's a good question. I don't know those rates, but having practiced in Southern California and Nevada for over 25 years, I think we do see quite a bit of that. However, people that are acclimatized to the sun and spend more time in the sun are protecting themselves. The more pigment and color they have in their skin, the more protected they are from certain sun-inducing skin cancers, because not all skin cancers are sun-induced.
Right. And how then do the locals manage that? I mean, is it a case of, you're wearing the cap every day, or you put the factor 50 on, or you stay
Yeah,
hydrated?
yeah. And although it's controversial now with they wear high levels of sunscreen, the SPF skin protection factor 50 to 100. We have a lot of pools here, and the casinos have these big pool parties, these day clubs, if you will, and a lot of people at these things. So I there's a lot of sunscreen, a
Right.
lot of sunscreen.
Okay. I tell you something, in Ireland here at the moment, I think we have 17 degrees Celsius, and we're all burning. We're stuck inside. We're crispy, nice and crispy at the moment. So can you tell listeners? So go back generally even where it all began or all started. Tell listeners a little bit more about yourself and your background.
Yeah, I mean, I grew up in a small town in the Midwest, in a state called Ohio. You know, sort of older U.S., an older town. And during the oil embargo of 1979, 1980, the economy was bad. So our family sold the family business and packed up and moved to Washington, D.C. area where I finished high school. And I knew I wanted to be a physician. I was always taking science classes and in high school, I actually worked at the National Institute of Health, which conveniently is in the Washington, D.C. area, got more exposure to where I was headed. So I knew where I was headed. Had a great 4 years at college. I went here in the U.S. You call a nerd. I don't know if you use that phrase where you are, but we're always just nose in the books, interested in scientific things, just how do things work. Had wonderful professors and a fantastic education in molecular biology and biochemistry, and then went right into medical school. So no breaks. So went back east to medical school, and medical school is like a stepping stone for me. I really was just trying to get to my residency so I could start helping people. So I knew I wanted to go into neurosurgery. The neuroscience, the brain, was sort of the final frontier of medicine. We knew as little about that as possible, so I was driven that way. Had some mentors that encouraged me that way. So I matriculated into a neurosurgery residency, and during that residency, I became enamored with the spine. And part of that was because our particular residency was more brain focused, and I really wanted to learn more about the spine, which is part of neurosurgery. So I did a spine fellowship, a special year in that, and I opened up some, amazing ideas and doors into the areas of biomechanics. So I have all these diverse scientific fields that were pouring into my neural networks. And I get to say neural networks now because everyone is using AI tools, and AI is really neural networks. It's a pattern recognizer, right? So the more information you have into your database, hopefully the easier it is for you to recognize certain patterns. And medicine is all about that. So I went into practice after that as a neurosurgeon, highly focused in spine. I took care of thousands of people with neck and back injuries, disc problems, other types of problems, and brain issues, nerve issues. Always trying to make, as a surgeon, I was always trying to make surgery the last option, right? And they tell us that in your residency, you'll learn how to operate.
Yeah.
And then in your practice, you learn how to help prevent people from needing that operation. And in fact, there's no one better to advise someone on how to avoid that than a surgeon, in my view. So I had always tried alternative things. And, you know, probably 15 years into my practice, I noticed the significance of a gap. And the gap is that people with spine problems, would go through what we call the non-surgical treatments. They would try physiotherapy. They would try perhaps some medications or anti-inflammatories. They might try time. They might just rest. They might try some injections. We call those, steroid or cortisone type injections. Uh, Most of them are called epidurals, but not all of them. And those would be something we try. But there were a great number of people who those things didn't work for or didn't work adequately or long enough. And they would come back and say, I'm still suffering. I can't, play my sports. I can't enjoy my children, play with them, that kind of thing. I've got this problem and I can't work like I used to if they're laborers. And I would say, well, all these things haven't worked, so I guess we should look at the surgery menu, you
Okay.
know? And they would say, oh, but wait, I'm not ready for surgery. And I'd say, good, because I really didn't want to offer it to you. And I don't think you're bad enough because you're still functional. You're annoyed every day. So they would say, well, what else you got, doc? What fills that gap? And that gap has always been there. I've always looked at new things for the gap. And some of them would say, how about crystals, lasers? And then enough of them said, how about stem cells? And luckily, that old background in molecular biology and biochemistry came roaring through. I said, I wasn't trained in that, but at some point, I should look back into it because I'm a nerd and I'm interested in that stuff. So one fine year, about 2018, I said, instead of going to the annual neurosurgeons conference, where a bunch of bow tie wearing nerds pat themselves on the back for doing the same thing they've done 50 years in a row,
They love you for
I, yeah,
that.
all right. I decided I would go to a stem cell conference, and it opened my eyes to what had happened in the 30 some years since undergraduate time. And a lot had happened. And most of what had happened, David, wasn't in the USA. It was in Europe and in Asia. And we were just sheltered from it and late to the party. And I don't know how things are where you are, but a lot had happened where there was good science, good medical evidence, good scientific publications on the efficacy and the safety of these types of things, stem cell based endeavors, what we call regenerative medicine, which is tapping back into the body's own natural way to create itself, heal itself, maintain itself over the years. And we're tapping back into that strategy to use it as a trick or a therapy. When we say trick, we say a biohack or a way to help someone who's not healing as fast or as well as they normally would like or used to, and sort of encourage their body to do so. So that's what this is all about. And I started to employ this into my practice for my spine patients, but also it's opened doors to so many other things we treat now. So I'm not just a spine doctor anymore. I tell people I'm a recovering neurosurgeon doing way, way fewer surgeries than I had ever done. But I enjoy it because we are addressing structural problems for people, joints, spine, things like that. The joints are the low-hanging fruit of regenerative medicine. We tend to get measurable results there, both in how people are doing and imaging and MRI results, things like that. Although the real outcome is how do you feel, how do you function. We also use these biologics, so they're not drugs, they're biologics. We use them for people with inflammatory, hyperinflamed syndromes like autoimmune problems, like Lyme's disease, like people suffering from the long effects of COVID. We call it long COVID here, long COVID syndrome, and other ailments. Um, and because inflammation is really the root of aging, you may have heard the term inflammaging.
Yeah.
This accumulation of chronic inflammation is really what ages our cells. We're also using these biologics as a strategy to slow the biological process of cellular aging, which in a way can help slow your bodily aging. So people come in and use this as an anti-aging tool. We also have some other miscellaneous things we're doing. For thinning hair, we have some scalp injections, we have some facial rejuvenation. We always have to leave some cosmetic applications. We have sexual function, sexual health injections of these biologics, both for men and women. We use these for other miscellaneous things. And then now we have some, and that's more generic use of stem cells and stem cell messengers we call exosomes. And we can get into that more if you like later. But we now also have a subset of exosomes from natural killer cells. And you might say, well, what are those? Those sound dangerous. It sounds like a bad, horror movie I
Like a
have to go
movie,
watch.
yeah.
Right. Well, natural killer cells are actually something quite good for us. They are part of our immune system. The immune system has in part white blood cells, right? And you get infected, your white blood cells rise and, you know, populate and deal with that infection. Well, a very small percentage of those white blood cells are NK or natural killer cells. They have a job of identifying and removing abnormal cells in our body, and they do that all the time. It's like background surveillance, like a security system. So they remove senescent cells, which are these very aged cells that are leaking toxic, chemical messengers that take up resources and space, but don't contribute back to the community,
Right.
right?
Yeah,
We all have those people in our community. We have
we
cells
do.
in our body that do that. So these are called for fun, they call them zombie cells.
Okay.
So, and natural killer cells can identify and remove selectively these zombie cells, cause them to rupture and get their parts recycled. Well, natural killer cells can also identify and remove tumor cells. And we like that because during our lifetime, we make accidental tumor cells, cancer cells. We do. But they are removed used by this natural killer system, this surveillance system.
Right.
So it's only when that natural killer system is depleted, depressed, not as good, exhausted, and the cancer cells can sort of evade and overcome that system where you get a full-on tumor or cancer problem or diagnosis.
Right.
So natural killer cells kill their victim cells uh, by a small particle messenger called a natural killer cell exosome. So here I've brought that word up
Yep.
twice.
Exosome. I'm just repeating it so I can, just
You're going
verbatim.
to hear this.
Exosome.
Yeah, you're
Exosome.
going to hear it more and more and more. And the exosomes are really doing the work. So we actually now have access to NK cell exosomes that we are using to augment people with cancer, helping their body to fight the disease because we're augmenting their natural killer system. We can inject them directly into tumors. They're so small, they travel very well throughout the tissue. We can also use them IV to help identify and suppress circulating tumors that might want to set up a metastasis. Also, people that have been treated and might be in remission, this can help their natural killer system keep them in remission. So we're learning more about them, using them in different strategies. So we have a lot of projects in this space, in the regenerative medicine space, involving stem cells and stem cell signaling factors, the exosomes. That's what we're up to.
We might as well talk about this now, actually, because it's so interesting. So I don't have to kind of trip my words up later on to ask you about it again in relation to exosomes and everything else. But okay, let's start then to keep it as simplistic. Excuse me. Just to keep it as simplistic. So for anybody listening to this now, before we go kind of deeper, what is a stem cell? What is it? Do we have it in our bodies already, or
Yeah,
does
we
it
do. We
deplete with
do.
age?
Yeah, so a stem cell is a a cell that has not yet been defined as its final job in your body. And there are different types of stem cells. So, for example, when you are a fertilized egg in your mother's womb, you are a stem cell. You are the omnipotent stem cell. You are going to create a human.
Okay.
Then those divide and what have you. And they divide, and eventually they divide down many times and become an embryo. And then the embryo starts to look like it's got a face and limbs, and at that point, these omnipotent stem cells become a little less powerful, still wonderfully powerful, called pluripotent stem cells. They can't form a whole human, but they can form a limb. You think about other species that can regrow a limb, you know, lizards and starfish and all kinds of things, you know, and we're looking to tap back into that biology so we can help people regrow a finger or a limb or something. So that exists at the pluripotent stem cell level. And then they divide and specialize more, and you've got a formed humanoid in there, the fetus, and then you've got organs, right? And these organs and in the bone marrow of the fetus maintain a bank of stem cells. There are also some in the fat tissues and other places, but the bone marrow is probably the number one source of stem cells. And those stem cells are multipotent. They're not omnipotent or pluripotent, they're multipotent. And those are typically what we use in the clinical setting. And those cells are there throughout your life, and you call upon them to help you grow and develop when you're a child, to heal a wound or from an infection when needed, and to replace damaged tissue. And sometimes that's normal. Like we replace our skin all the time, right? You're constantly generating new skin cells and sloughing off the dry skin on the outer layer. But sometimes you need new liver cells and what have you. So they're drawn from this bank of stem cells. As we age, though, those stem cells become less effective and some of them become exhausted. And one of the theories of aging speaks to stem cell exhaustion. Um, and the faster they get exhausted and the more inflammation they're exposed to during your lifetime, the quicker they become less useful. So you think about exposure to things in our food we shouldn't have. Now, here in the US, we're poisoned on a daily basis. I hope you are not.
Hope not. No.
We're always comparing our ingredients on the box of some food substance to a European version, and ours has 30 more ingredients and preservatives, so it can last on the shelf for 12 years.
Right.
So there's a big move afoot now here in the US to clean that up and go more European, which we're supportive of. But our cells are exposed to all that, and in being exposed, they become chronically inflamed to defend themselves against these bad things, and that inflamed state affects our stem cells as well. So our stem cells can get aged, if you will. So that's what a stem cell is, and that's why they're so useful to us, and why we might need some replacement or encouragement when our stem cells become exhausted, depleted, less functional, overinflamed.
So why is it then, Dr. Jeff, that there's not so much push for this or information in relation to stem cell therapy? I mean, we seem to see, I don't know about in the US specifically, but in Europe, you mentioned earlier on, is there kind of like more availability of this treatment? I think I've only probably seen one advertisement in the last 6 or 7 months, and it was got to do with using stem cells for knee recovery. Uh,
Right.
of some, I don't know, don't even know what the company was. You're looking at it kind of going, is this a real company? Is it a fake company? Because you actually don't know much information about it because we're always used to the old traditional techniques. So, what would you say to a listener in relation to this treatment, stem cell, compared to a standard treatment?
Well, one of the jobs of a physician is to provide all the available options and help a patient weigh the pros and cons of these different options and look at them. So the problem here is, at least in my experience, is that modern medical education in most settings does not have a component of regenerative medicine. So I think it's coming and there's a lag here. So the people pushing the envelope are really the tip of the spear in this clinical availability of these types of things. So you're not going to find it from a regular physician. You're not going to find it from an institution, a big institution, except maybe in some research settings. And you have to know about it and be interested in it and seek it out. So most of the patients that find me are already inclined. They've heard something cool about stem cells and they want to see what that is all about. So you have to be a self advocate and a self educated person in this realm. And at least here in the United States, we are suppressed from advertising much about it at all. We can't place ads on Google, for example. We can't have Facebook ads. Because it is not yet approved for marketing claims by our FDA, which is the organization that
Yeah.
oversees that. So so that's why it's slow here in the US. And it's just a slow adoption like anything. I think it's just new, and even though we're tapping back into some very natural and old-fashioned concepts, there are, if I may go off script a little bit
Yeah,
here,
sure.
there are cultures going back thousands of years that knew the value of the placenta, and they would prepare it, cook it, eat it. They would dry it, use it as for wound care because it is rich in stem cells and in stem cell derived exosomes and growth factors. So this isn't new technology. We just know enough about it now to make it work.
Right.
So
It's
it,
interesting you
it's
said that because I remember I lived briefly in Asia, and the talk was there that they would, as you mentioned, they would use the placenta. And obviously I was like, "Ooh, what are you
yeah,
talking about?" You
right.
know. But yeah, you've backed up exactly what they've said. In terms then with the I mean, have you had many testimonials from individuals that have actually used these type of treatments, whether it be on the spinal or any other areas of the body, which
Yeah.
have seen a mass improvement from, say, traditional kind of techniques?
Oh, absolutely. I mean, it's like nothing's a miracle cure, right? We have to temper this in reality. So, but we have, and we stack the deck to make sure people, can have the best outcome they can achieve. So we really focus in on what their problem is, and we don't just give it to everybody. We make sure they're a good candidate first. People with, inflamed problems in their body, we check lab tests look for inflammatory markers in their bloodstream, and those people tend to have the biggest responses.
Right.
We've helped people recover from, let's say, a heart attack or stroke, which have inflammatory components, or head injuries, a very big one now. We're even seeing some benefit in using the exosomes through a nasal spray, which is a pathway to let them get into the brain for children with autism, and which is, a very ubiquitous here in the United States. The other interesting thing is the exosomes are much smaller than cells, and you're probably thinking, Jeff, cells are small, and
Mhm.
you'd be right, but the exosomes are 1,000 times smaller. So where cells are measured across in microns, which is one millionth of a meter, if I can use your system.
Yep.
The the exosomes are measured as they're in nanoparticles. They're measured in nanometers, 1 × 10⁻⁹ in diameter. So are 1,000 times smaller than cells. So they can cross into the blood-brain barrier and get into the brain and the nervous system, whether if they're given intravenous or nasal spray. Whereas stem cells really don't. They cannot cross. If you get stem cells as a treatment, though, those stem cells do deliver exosomes to your body. So at the end of the day, the exosomes are doing the real heavy lifting, the work.
The treatment itself, I mean, what does it involve? Is it, you probably mentioned about the injections later on. I mean, is there patches? Um, so what is a treatment and are there any side effects that anybody should be aware of, obviously depending on the patient themselves?
Yeah, it depends on what we're treating. So if we do intravenous, besides the little, pain from inserting the catheter into your vein, the only thing we see is people that do have a lot of inflammation in their body, when they receive the treatment, it converts your cellular activity from pro-inflammatory, where you're fighting, your body cells are fighting against the environment, to one of anti-inflammatory, which is a more optimal functional mode for a cell, where it can do what it's supposed to do.
Yeah.
It's pro-health, it's anti-aging. So when it flips, though, it has to purge the old inventory. The old inventory is the collection of the small chemical signals that are pro-inflammatory. For example, if you have allergies and you sneeze a lot, if you get near a cat or whatever, your body releases histamine, which is why antihistamines are one treatment for allergies.
Yes.
Well, you think about if your body has to get rid of all these histamines, it gets into your bloodstream. We do see in some of these people, the minority of them, but we do see a 1 or 2 day inflamed state. We call it a
Okay.
flu-like syndrome. They can be tired, they can have a low-grade fever, and they can even have, muscle aches and joint aches, because these these negative messengers need to leave the body. You purge the demons, if you will. But after that, then they can reap the anti-inflammatory benefits, and they usually feel energized and refreshed, fewer aches and pains. Just depending on what the symptoms were going into it.
And in terms of the body itself, is it just specific to say joints or organs or kind of help skin, other areas of the body?
Yeah, there are different applications across all organ systems, uh, but we do like to define the problem, measure the problem. So, for example, if David, you said, "Oh, my knee's been really, wearing down. I have an old injury. It's degenerating." People throw around this word arthritis, which is very generic. It's very broad.
Right.
But we would actually look very closely at your knee. We would do an MRI, high quality MRI. We would look for targets in the knee, and this was all defined by French literature that goes back with 15-year follow-up, where they defined how to approach these joints using regenerative therapy. So this is this sounds new, but it's not. It's been around, and we would approach exactly where the problem areas are, and we would inject the biologics uh, into those spaces exactly. We don't want to put it where you don't need it. We want to be highly precise so you can get the best result. So we do a lot of these, we'll call them joint injections. And we have some examples where we've done MRIs a year later and we've seen some regrowth of the cartilage. So we're very enthusiastic about the results here.
That's amazing. I mean, I mean, I dread to ask this question, but are we talking expensive for this treatment? I mean, obviously you're in the USA, so things might be slightly different over here this side of the world. But is it accessible at this present moment in time to the average kind of Joe?
Yeah, no, this is a good point, David. So, most like if a couple doses in the knee, you know, with the facility, we do it in a sterile facility with a little sedation and everything. You usually are under 10,000 US for that.
That's pretty good.
Um,
I hate to
it's
say
yeah.
that's perception. Anybody listening here saying pretty good, but things are expensive these days, especially for your health. Yeah.
It's a lot less expensive than a surgery, a knee replacement surgery. It has no downtime. Uh, you're sore for a few days, but like anything, you're probably already sore if you're having the injection. And it's the stem cell procedure is more expensive. So the exosomes are more abundant because they're donated. They come from amniotic fluid.
Right.
So, and we use fresh frozen amniotic fluid concentrate. So it's got stem cell derived exosomes. It's got growth factors in it. It's got all the good stuff that makes a baby. It's like a sci-fi movie where you're injured and we put you into a vat, some high-tech vat, and you come out, a day later and you're as good as new. This is sort of the amniotic fluid version of that. So because amniotic fluid is so much more abundant and collectible, the price compared to stem cell treatments are much less. So these exosome preparations are bringing the price down. So it is accessible. It's not too far out of reach for most people.
And do you take international patients, or do they have to be? So, say for example, here's Dave. I have a problem with my knee. I want to fly from Ireland over to sunny Vegas. Um, I mean, is it open to everybody once in
Yeah,
that situation?
yeah.
They have the possibility of payment options.
Yeah, we don't discriminate. We take people named David and from the part of the world. We had people from the UK and from other places come in. Luckily, Vegas is accessible.
Yeah,
I believe there's a direct flight on British Airways from Heathrow, so you'll just have to hop over there and
even from
catch.
Dublin now, there's a flight to
Oh,
Vegas.
is there? Okay,
Yes.
wonderful. Yeah. We have an incredibly busy airport, and we continue to add resorts and hotel rooms, and it's not just for tourism. We have a lot of very large conferences here in town as well. So this is just a destination. But I do recommend not coming in late July through mid-September. Just
Right.
unless you want a good sweat. But yeah, in terms of payment options, we don't have anything fancy quite yet, like financing, but we've made it very accessible, and most of the work we do ahead of time, just to be fair, David. So we do the televideo medicine. We get to know each other. We look at records. We might order some tests you can have done in your own area. an MRI, for example, I can bring it up on my screen and share it with you. And so we'd only invite you to come here if you were a candidate and wanted to proceed, right? So you don't have to come see me unless you're really coming to see me to do
Yes.
something.
That's
Yeah.
excellent. I mean, if anybody's out there, you can get your knee fixed, head off to the casinos, and then injure your knee again, having too much fun in Vegas, and then get it fixed again. So it's a definite. I just want to ask briefly. You mentioned AI earlier on. I mean, are
Yeah.
you, in your own opinion, are you kind of like a lot of people? There's a lot of fear at the moment with AI. Do you think it can help the medical field?
It's
Do you
already
think what they're
helping.
doing? Yeah.
Like I noticed, it's a pattern recognizer. So it's going to be better. It already is better at recognizing patterns based upon experience and expertise. So you have to train these neural networks. So most of the AI out there is trained just by looking at books and internet source data, right? It pulls from and a human to do a research project and pull all the diverse information would be it's laborious, right? It's a thesis, it's a PhD,
Yeah.
where AI can do it like this. So it just think of it as a shortcut. So in medicine, you think about, wow, someone comes in with strange symptoms and it's not something you normally see. You can put this out in the internet and let the neural network, the AI, give you some ideas of what it is. The doctor still has to have the final say, of course. But you think about like breast cancer diagnosis. You look at mammograms and they are complex. They have calcifications and different sizes, different that thing like that. There's some new tools that are seemingly better and faster at diagnosing something earlier, right? Because we have a series of data and someone who's had like 20 mammograms and they accidentally, at some point they got cancer, sorry. But you look back at that earlier mammogram and what could we have seen differently? And still the human eye can't pick it out, but an
Yes.
AI who can learn from this can identify these things earlier now. So I think there is benefit. We're going to use that mostly on the diagnostic side.
Have you like received any, I wouldn't say backlash, but any criticism or negativity from the industry because of
Oh
what
yeah.
you're trying to, you're
Oh
kind of
yeah.
going in a different direction?
Oh, sure. I mean, first of all, there are myths out there. Myth one is, oh, you're harvesting babies, aborted babies for embryonic stem cells. No, we're not. That's ridiculous. Everything we do is a certified, approved process through getting these materials. Number two, that you have to leave the US. You have to go to Panama or Colombia or, to get stem cells. No, you don't. We have them right here. We have them everywhere. You have them where you are. I have them where I am. Number three, it's illegal in the US to do this. No, it's not illegal. It's non-compliant to make any claims, marketing claims that aren't yet approved by the FDA. So we're very, very clear that we're not making any claims that we can cure or treat a disease or condition. Their words, not mine. I can show you examples of things we've helped people with who might have had a disease, who might be treated or cured. I just can't say I can do that for all individuals. That's why we go over all the options through a process of informed consent. So those are the kind of the myths that we deal with. Now, the people who have consumed the Kool-Aid. Do you use that phrase where
Kool-Aid,
you
yep,
are?
I get what you're
Okay.
talking about.
So, so and to be fair, if you asked me 10 years ago before I opened my eyes and took on this new updated information, I probably, if someone came to me and said, I want to look into stem cells, I would have said, I'm not ready for them. Yeah, I don't know enough. It's not yet demonstrated. We still have people that have consumed that Kool-Aid, that early medical education Kool-Aid, who aren't there yet. I just saw someone on social media, a physician, say it's illegal. I just saw it the other day.
Right.
Sent it to some of my colleagues. And there are
Does that
people.
frustrate you, Dr. Jeff, though?
No, I think there are always people who are stuck in the old ways and
Right.
haven't and aren't open-minded. And I forgot who said this. You may know. If you can't change a mind, why have one?
Hmm. Okay.
So that just speaks to their small-mindedness. But it's out there, and I think being open-minded and looking at things, and you can dismiss it later, but at least look at the data. There's great medical evidence out there, so it's not frustrating, and it actually, I think, puts me in a unique position where like I was telling you, people that are open-minded to these potential option treatments uh, are the people I want to treat anyway. So I don't want to have to convince someone. So I will let them have their old ways and not and be stuck in those ways. That's just out there. So that's really the kind of negativism I see is, and I've had other people I say, hey, I think I might be able to help your knee. Let's take a look at it. And they, oh, okay. And they go see their older orthopedic surgeon perhaps, and they say, oh, you can't, that doesn't work.
Right. Okay. They're not
You know,
open-minded. Yeah.
well, that's what I used to think. But
Yeah.
then I actually looked at the published peer-reviewed literature, and lo and behold, it does work. So that's what we're looking into.
Do you think down the road and the FDA will kind of change their mind in relation to these advertisements specifically? The more information that comes out, are they just being extra cautious? Because I do find this is going to probably sound a bit controversial to anybody listening to this at the moment, but we went through certain, virus recently or pandemic, and
You guys had that too?
yeah. So, so just in case you don't remember it, like it just felt like it was only yesterday. And obviously they released, certain medications or to help fight this, but from what I can understand, there wasn't as much information available at that time for
Right.
that, and it was promoted to a certain extent. So in your situation, I mean, with what you're doing at the moment, and you've been doing it for a period of time, I mean, do you see hope that it'll be implemented more?
Yes, I do. Unfortunately, for that to happen, the large pharmaceutical companies will have their thumbs in it and to monetize it. So it'll probably not necessarily be organic and natural and with the best intents and interests at heart for patients. It'll be to monetize it. That's unfortunately that's what it takes. It's a lot of money to get something approved by the FDA. So these large companies will probably have a role in it.
And why do you think it is then that say, for example, the pharmaceuticals per se, because it seems to be a lot of people are actually moving to a different direction of trying to heal the body. Why do you think
Yeah,
they're kind of going, well, geez, this is a big market now? Because I mean, you go into
yeah,
health food stores and they've wheatgrass this and natural that and all these
yeah.
vitamins and patches. And why don't you think to go down that road? I mean, it sounds more sense to me. I don't know.
Yeah, why? That's a great question. I hope we're moving back in that direction. If you look at Ayurvedic medicine from India and Chinese herbology, these things go back thousands of years. And we are just circling back around to understanding them and bringing them back online. You're absolutely right. And we have implemented some of that in our own practice because we don't want to give someone a stem cell or exosome treatment if their body isn't already optimized. If they go right back home and they're still in flames because their body's not optimized, then they're not getting the most out of it. So we like to look at their sleep, their lifestyle, their diet, their nutrition, their supplementation, where the vitamins and things come in. So we're doing that. There are also ways I should add this, David, to get exosomes in your daily life
Right.
and stem cell activation in your body. Um, Hormesis, if you know that word. Hormesis means a slight stress on the body to build resilience.
Okay.
Does help you release stem cells. Let me give you some examples. Fasting, 24 to 72 hour, somewhere in there fast will will increase your stem cells and exosomes in your body. High intensity exercise, interval exercise, strategic exercise. So if you just go run a marathon every day, that's not going to do it. Maintaining your muscle mass and your bone density come from those types of exercises. We need, and those are associated with longevity because if you're maintaining your moving parts, you're maintaining your bones, and your bones include your bone marrow, where most of your stem cells are. So if you want to preserve your stem cells later in life and live longer, healthier, and healthier longer, move, exercise. That's the one thing you could do. Sometimes that exercise might forgive a not perfect diet. Um, Hot sauna. The Finnish have published on this extensively. Hot sauna is a great way to release stem cell activity and reduce all causes of mortality. The alternative to that is cold plunge. Um, Some people do hot sauna, cold plunge. They call it contrast therapy. Those are great ways of doing hormesis. Um, so those are one way you can get stem cells boosted in your own body to help you heal something. The other areas are dietary. You can eat what we call colostrum. Do you have colostrum where you are?
I don't know, actually. You can tell me all about it.
Colostrum is the very first and most nutritious milk from a mother. And you can get bovine, which is cow colostrum, I imagine from sheep as well. It's high in exosomes. You can get also bone broth is a very popular health substance now. Bone broth comes from the bone stock of animals and usually beef. And that bone broth is rich in exosomes, and you can eat them, and some of them are bioactive in your body. Also, certain plants, many fruits and plants have exosomes, but you have to eat quite a few to
Right.
get the beneficial phytonutrients. So we're actually working on a project here very shortly. We will launch a plant-derived, it's from a number of selected fruits that are known to be anti-aging fruits, a plant-derived exosome in a capsule, concentrated. So basically like having mini baskets of fruit in a capsule every morning. So stay tuned for that.
That was pretty
It's
cool.
coming.
You
Yeah.
mentioned with the high intensity training, I mean, is weightlifting including that, or are we just talking about sprints and kind of cross
Yeah.
trainers and that type of stuff?
Yeah, no, high intensity can include some interval training with muscles. And if you're watching David's show or listening to this and you're interested in that, I follow the work of John Jankwish, who recommends one set of an exercise to failure, as opposed to the traditional 3 sets of 10 that you might have done in high school. So the working to failure, it says last few repetitions when you just can't go anymore, where your muscle releases the survival peptides called myokines. Those are the ones that go to circulate to the brain also and help prevent dementia. Those are the really where the work is done. So you can get there in one set. You don't need to do 3 comfortable sets of 10 that you complete. You're probably not getting the real muscular health build that you need. So you can do a high intensity workout, do 3 or 4 different muscle groups or exercises, and be done in 20 minutes, maybe less.
You mentioned there as well with the you're going to have your new capsule coming out. We'll get the plug. I want you back on to talk about that once
Anytime,
it's ready
anytime.
to go. What about supplementation? I mean, vitamins and herbs that kind of
Yep.
keep us going. Any
Yep.
suggestions?
Yeah, start simple with an anti-inflammatory group of things. So I recommend, because I have a lot of people come in, they want to get started, but I don't want to overwhelm them with, I'm going to show you this for those that are viewing this in the video form. I'm holding up this is my daily supplement bag. I produce a little plastic baggie of all kinds of different vitamins and supplements, one for me, and I have one for my wife. Hers are slightly different.
You might get
It's
arrested
probably
with that on the corner of the street. They're going to pull you over. They are.
Yeah, I'm gonna get in trouble for my vitamins at the airport, right? So the I start simple though, because I don't want to have someone who just wants to dip their toe in this anti-aging, medicine, longevity medicine, and have a bag like this. But I'm testing these so you don't have to. But if you want to start, the best anti-inflammatory few I would start with is first a really good omega-3 supplementation. And typically, fish oil is what we're talking about here. I recommend 3 grams a day or 3,000 milligrams a day. Um, if you look at people in the blue zones are where people live longer, like the certain areas in the Mediterranean, in Okinawa, things like that. They have very high omega-3 indices,
Right.
uh, meaning they have a lot of seafood, fish, fresh fish in their diet. So you have to get the omega-3s. Omega-3s are highly anti-inflammatory. The second thing I would take every day is a good probiotic, unless you're eating farm fresh, dairy and something fermented already in your diet. Here in the U.S., we eat, frosted flakes from a box, so we're poisoning ourselves. I recommend a probiotic. The proper mix of bacteria in your gut contribute to We're mutual with them. They help us. We give them a place to live. They help us. So they contribute to reducing inflammation. So that's important. I recommend also vitamin D3. And some people say, "Oh, I just go out in the sun and I get vitamin D3." Well, it's true that you convert vitamin D2 to vitamin D3 in the sun, but who knows if you have enough vitamin D2 in your body. So I recommend 10,000 international units of vitamin D3 a day, highly anti-inflammatory, and taking that is associated with a reduction in all causes of death. So if you want to live longer, take your vitamin D3. It's also part of the recipe for making bones. So if you want to maintain your bone density, vitamin D3, it's the only vitamin that's a functional hormone.
Okay.
Vitamin
Vitamin.
for where you are,
Okay.
vitamin where I am. And the some people don't absorb that orally well. I don't, for example, and you can do it as an injection.
Okay.
But you have to go once a month and have, someone do that. Uh, Next, I recommend now the last two are nighttime. So bedtime medicine would be magnesium. I usually like a triple form, comes in single capsule. It helps support many cellular processes that happen, particularly at night when we do our repair. So we really need to respect our circadian rhythms. When it's dark, we're not supposed to eat, and we should be winding down the brain and decreasing inflammation. Because during the day, we're busy doing things, we're stressed. Cortisol is circulating, the stress hormones circulating through our body, stressing us so we can survive and get things done. But that's pro-inflammatory. At night, we need the antidote. So the antidote is melatonin. So even if you go to sleep well, I still recommend a good melatonin. It does support many cellular repair processes at night. It's a hormone made by the pineal gland in the back of the brain that tends to shrivel up after puberty
Right.
and stop producing much. So if you have teenagers in your life, I don't know if you have children, David, you have
Yep. I
teenagers.
have three kiddies, two teenage girls.
Okay.
Trouble ahead.
Have you noticed it's tough to wake them up in the morning?
They were like that since they were probably like they were born. They're just terrible sleepers, or they're good sleepers anyway.
So if you mostly teenagers are very difficult to wake up because they're practically comatose from sleep because they have so much melatonin in their system.
Right.
So, as adults tend not to sleep as well or dream as much. Why they're not sleeping as deeply. You're not getting the good repair, the cellular repair at night. So I recommend melatonin. I take a dissolvable. Uh, the brand here in the US, I get a bottle of 12 milligram dissolvable. 300 dissolvable tablets is less than $10. So
Right.
I just get that on Amazon just to have it sent to us. So you can find something. I recommend dissolvable because it's a peptide. Peptides are very popular nowadays, but they're small protein fragments. If you eat a peptide uh, into your stomach, you'll dissolve it and won't have its desired function. If you dissolve it under your tongue, it gets absorbed by the blood vessels under your tongue, gets into your bloodstream without being digested. That's what you want.
What about there's a bit of a fad going on, however, here in Ireland is collagen. Is
Yep.
collagen of help or
So protein, most humans don't get enough protein, at least here in the US. We are raised on corn and carbohydrates. And you need to maintain your muscle mass, as I noted earlier. And to do that, you need your muscles made of protein. You need to eat protein because our structural elements are supported by a very popular and voluminous protein called collagen. We need the building blocks. So collagen supplementation is a really good protein supplementation for us. So I take a scoop of collagen at least once a day. Um, I actually will pour it into my coffee in the morning. They make a chocolate one, and I'll turn my coffee into a little treat.
Before I'm taking, gee, I could talk to you for hours, Dr. Jeff, but I don't want to keep you much longer. I want to get you on the podcast again, especially when you get your supplement or your plant-based capsule. I
Be happy.
just want to touch go back on the natural killer NK cell derived exo. You can finish it. There
Exosomes.
you go, exosomes. For somebody that's listening to this podcast that may be having some sort of illness, maybe cancer or you know, they're not the best at the moment. What would you say to them? I know you're saying that, you try and research, get the best option for them, and what is the process then for them if say they've done chemotherapy, radiotherapy, it's not been successful? You know, is this an option then down the road?
It's something to look at any step of the journey. It could be part of what you do between cycles of chemotherapy or radiation therapy. It could be, an alternative. Some people just are just a hard no to, chemotherapy. Chemotherapy is a strategic poison. The goal is to poison the cancer faster than you poison yourself, right?
Yeah.
So that there are people that just don't want that. There are, and you're right, there are some cancers that just don't respond to chemotherapy well, and this could be an option for them. We are learning more about it all the time. This is very new. So we have some people get it IV. We have some people who are injecting it right into the tumor itself. I will say we are building our own injection facility in my office where we will have a state-of-the-art three-dimensional CAT scan imaging where we can guide a needle right where it needs to go with more precision. So probably in the next 6 months, we'll have that enhanced capability to do that. So we'll be able to reach almost anywhere.
And the treatment itself, I mean, is it less, a lot of people I've had family members have had cancer, and the treatment, the chemotherapy and radiotherapy. I mean, is the side effects, because that's usually one of the biggest issues. I think there was a pal of mine went through chemotherapy. He kind of explained it as shotgun pellets, kind of aimed at the body and then hope for the
Yeah.
best, so to
Yeah.
speak.
Yeah.
And that's if anybody's listening here to go, they're experiencing cancer. I don't mean that as any, to belittle anything like that whatsoever. That was his way of actually coping with
Yeah.
the cancer at the time. So, I mean, with the side effects and stuff like that, are they less, well, for what's known at the moment with the natural killer
Yeah.
therapy?
David, luckily, we have yet to see any side effects from NK cell derived exosomes. I've been very enthusiastic about that element. And we want people, there's so much evidence that, staying healthy and eating right and exercising if you have cancer help fight the disease. We want to keep people from being sick from the treatment. So luckily, the NK cell exosomes fit that goal.
No, it's brilliant. It's absolutely brilliant. Before we go, I'm looking at your website, just be nosy. It's I just want to pronounce it correctly. Is it recelebrate.com?
Correct.
Recelebrate.com?
There you go. So we're celebrating the renewal of your cells through this
Wonderful.
process. Resell, as you
Yeah.
said, ebrate.com. And that's our social media name. And you've just searched that word. I think we're the only people using that word this way. So you should be able to find us pretty easily.
So there's lots of information on there. There's the contact information, there's services, there's resources, there's podcasts, there's everything that you want to know. And for getting in touch, Dr. Jeff, is it the best way via the website, or you on LinkedIn's and Facebooks and Instagrams, all that type of stuff?
We look at all of it, but the website's probably the easiest. There's a little form to fill out. We'll reach out back to you the next business day or what have you. Just reach out. We love to meet new people, and we can't help everyone, but we love to try so we can at least talk it through.
Cool. Well, thanks so much to Dr. Jeff for talking me the Wellbeing Career podcast. As soon as the podcast is approved, it'll be released, and put all the links in that you can contact Dr. Jeff directly. I'll have you on, Dr. Jeff, again very, very shortly. So thanks so much to Dr. Jeff again for joining me today.
Thank you.